Good morning, friends. I am Dr. Ashish Sabharwal, urologist and neurologist and robotic surgeon from New Delhi, India. And today I will introduce to you one of my very good friends, Dr. Khalid, who has come from Iraq to train with me in penile implant surgery. So we will take his full interview and learn from his experience how his training was with me in penile implant surgery. So, Dr. Khalid, please introduce yourself.
Okay, thank you, sir. Hello, everybody. I'm Dr. Mohammed Khalid from Iraq, medical city from Baghdad. Came from Baghdad for training about the surgery of penile prosthesis. Even if a few days I'm here in this hospital, but I learned more information and all principle about penile prosthesis. I'm trained this on hand-on training. About the inflatable prosthesis and the malleable prosthesis. I'm seeing the Peyronie's disease and how to deal with Peyronie's disease, and also this yesterday to do application in the best way. This is the last day in my training course when I finish all the principle of the penile prosthesis. Really, I learned more information. And I thank you so much, Dr. Ashish, about everything to do for me.
Okay, so basically, Dr. Khalid, why did you choose to do training in penile implant surgery?
Because this is the modern surgery now, and in my country, really this new technique, and not all doctor know about know to do this procedure really, and came from the Iraq for this reason really.
Okay, so it's a common problem actually, and you should know how to treat it well.
Yes, this is very common in my country.
Yeah.
Yes, sir.
So why did you need to come all the way to India for training? What was the reason to come to India all the way?
Because in India, this is the best location or the best hospital, and with Dr. Ashish, this is the famous one to do this surgery, really.
Okay, but so basically, did you get exposure of this type of surgery in Iraq as well? Have you seen this type of surgery in Iraq?
Really no.
Okay.
Few want to do this procedure and not learn this procedure in my country. Really.
Okay. So overall, in these days, how was your overall experience?
At the finish of the
course? in our training program.
This is very good. I'm training and really I'm ready to do this procedure.
Great. So totally, how many days did you spend with me?
About 6 to 7 days, really.
Yeah, you came on Monday, right?
Monday, the first.
Monday, and today is Friday, so it's basically 5 days.
5 days, yes.
So in 5 days, how many surgeries have you seen?
How many surgeries? More than eight.
Yeah, so what all type of cases did you see in these 8 surgeries?
Cover all the cases. First one to do the inflatable prosthesis, second one in malleable, and Peyronie's disease, the application, the Indian implant, all cases really covered my course, all case of and all principle for penile prosthesis.
Yeah, and also we did penoscrotal incision, we did circumcoronal incision.
Several approaches, yes.
Yeah, several approaches. And also you had exposure in the pre-surgery workup of the patient.
Yes, sir.
And you were seeing the post-operative results.
To see the patient and open the wound and see all things here.
So basically, just doing the surgery is not important. You should know how to handle the patient post-operatively also.
And see the follow-up of the patient. It's so important.
And during this 5 days, did you get any hands-on?
Yes. From third day or second to third day, I'm hand-on. Yeah. And this is very more to make me more expert to do this procedure. Really, this is the first time, but now I'm at the finish of my course. I'm ready to do the surgery.
Excellent. So, what is your plan after going back? Do you want to start penile implants in your center?
Yes.
Okay.
Yes,
very
sir.
good. All the best for that.
Thanks.
And see, friends, like many people ask me, my anesthetists, my co-doctors who are in the hospital, they ask me, why do you take so much interest in training the doctors? Like if they also train in penile implant surgery well, they will become your competitors. So my basic concept is that, see, first of all, I cannot treat all the patients. Like Dr. Khalid has come all the way from Iraq, and if a erectile dysfunction patient comes to Iraq to him and he tells them that go to India, everybody would not like to go to India because of the language problem, logistics, travel, cost of the travel, everything. It is very difficult. So I cannot treat all the patients. So if there is a doctor who is trained well in Iraq, then he can treat the patient well and patient will be happy. Supposing the patient goes to another doctor who has never trained and he does experiment on the patient, so ultimately patient is going to be at a loss. So first of all, my aim for training is that for the society it is a betterment. Secondly, when I train my doctors, I also think, I also talk, I also do my reading and then train them. So basically my scientific way of treating the patient, how to do the treatment properly, all those things improve. When we share knowledge, even our knowledge gains.
Yes.
And thirdly, I always feel that when you train somebody, he's never your competitor. Like somebody who wants to learn, if I don't teach him, he will go and learn from somewhere else. So now when I have trained some doctor, I become his mentor and his friend. If he trains from somebody else, then I become a competitor. So when I train a doctor, I never feel that he's going to be my competitor. I always feel that he's ultimately going to be my friend. So friends, by this I would like to end this interview with Dr. Khalid. Thank you to Dr. Khalid for coming and spending his time with me. And if you're also interested in penile implant surgery training, you can contact me on email or WhatsApp and we will discuss further. Thank you.
Thank you, sir. Thank you so
Thank
much.
you.
Thank you, sir.